Hello, here I am Rahul Kumar Pandey, and today I discuss about pneumonia. We all know that pneumonia is a bacterial disease where it causes that if in the lungs, whenever the or fluid or the other liquid materials are filled. Due to this, the oxygen is not properly inhaled with us. So at that time, pneumonia will causes. So we briefly understand in this video that how pneumonia causes and what is its effect and what recently report are proposed. Okay, so pneumonia is a form of acute respiratory infections that affects the lungs. So we all know that this is the respiratory infection. Okay, the lungs are made up of small sacs called alveoli, which fills with air when a healthy person breathes. So there is a space which is called alveoli. Okay, in this alveoli, there is filled with some fluids and pus, which so when an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limited oxygen intake. So we all know that if space reduces in the lungs, then there is a and there occurs the problem in oxygen inhaling. Okay, what is the causes? Pneumonia is caused by the number of the infections agent, including the virus, bacteria, and fungi. The most common, basically, the pneumonia is spreads through the bacteria. Okay, most popularly bacteria. So bacteria, so antibiotic are there who helps to reduce this. Okay, so we study about the what type of pneumonia occurs here. So there is a word that streptococcus pneumonia, the most common cause of bacterial pneumonia in the children, or another is the hemophilus pneumonia, which also occurs through the bacteria, but this is the second most infected pneumonia are there. So we don't study about this. There is a streptococcus pneumonia are there, which is the most popularly bacterial pneumonia. Okay, so transmission, how pneumonia can spread. Pneumonia can spread through airborne droplets from cough, sneeze, or blood. Okay, especially during the shortly after the birth. We can see that the especially the 5 years below 5 years children if mostly affected with pneumonia. Okay, so what is the prevention of this? Pneumonia can prevented by the immunization adequate and by addressing environmental factor. Okay, so antibiotic are there which helps to reduce the pneumonia, and also ors, that is the oral rehydration system solution, which is used to reduce the pneumonia. Okay, so treatment, what is the treatment? There is a, we discuss about that, there is the antibiotic is there which helps to reduce pneumonia. Okay, death caused by, according to the WHO, है ना, recently WHO proposed the report that pneumonia is the single largest infectious cause of death in children worldwide. We all know that pneumonia killed about 8 lakh children under the age of 5 in only 2017. Okay, so in India, what is their number? This is about 1.5 lakh children are affected through pneumonia. Okay, affected, or I thought it's killed through pneumonia, about 1.5 lakh. Okay, and 15% of all deaths children under 5 year old, their accountability is 15%. So the WHO and UNICEF, that is United Nations Children Education Fund, so this both having their one initiative are there, that is the integrated global action plan for pneumonia and diarrhea, GAPPD, aims to accelerate pneumonia controls with a combination of interventions to protect, prevent, and treat pneumonia in children. So for pneumonia, for we if we know about pneumonia, then there is a prevention which is a antibiotic, ORS, and vaccination are there, which is used to reduce the pneumonia. So we have to aware all this, and this is the pic which is helpful for us to understand that what is the main cause of pneumonia and how can we reduce it. Okay, thank you for all.